Uganda People's Defence Forces Engineering Brigade has successfully completed the construction of Busolwe Hospital staff quarters in Butaleja district. This impressive project comprised of 74 staff units, meticulously rehabilitated and constructed to provide a comfortable living environment for healthcare workers in Butaleja district.
Today we are here in Busolwe. Busolwe, basically we have been doing a rehabilitation of the staff quarters in Busolwe Hospital. And today we have come to hand over the facility to the end users so that they can make use of it. Well, of course, you know, the objectives of these projects have been to make this place usable for the staff, whereby you see the environment, healthy environment for a medical worker, will enhance the morale, will give them the motivation, and also retention. You know, retention capacity of medical workers, you know, these people are still few. And if you give them an environment that is conducive, you can be able to have them work. You can also attract as many as good workers who come, because when somebody comes to this kind of environment, it is a good working environment. So those have been the objectives. First of all, to rehabilitate this facility, make it good and usable, accommodate a number of staff, so that, you know, before we came here, this place was totally dilapidated, but as you can see now, it is new. So the objective was have it good so that staff which have been renting in the towns, which have been far coming here, can be here and they can deliver services to our people.
The Minister of Health contracted the Updf Engineering Brigade to execute this critical project, emphasizing the importance of timely completion and adherence to quality standards.
Well, as you can see, we've done a lot in the structures itself. Here we intend to accommodate over 74 staff. There are those staff quarters which are 2-in-1. There are 8, giving us 16. And then there are these 2 big blocks. Each occupy 12, that's 24. And then these other ones you're seeing this side, those ones are about 6, they occupy 5 people. That's about 30. Then there's 1 block that takes 4. So that brings you a total of about 74 staff here. The specific works we have done here, we have replaced all the roof, as you see. We had to work on the roof. You see the new iron sheets. The floor, we have redone the floor. You can see the floor is terrazzo floor. The verandas, the splash aprons. When you go inside, you can look at all the doors have been fixed. All the new windows have been put. And the electrical items have all been put, electricity. The new plumbing system has been put. So basically, all the rehabilitation has been done. We have put everything new. So that's what we have done so far. Come out here on environment, you look at the environment, the landscaping. We have worked on the compound, planting this grass, paving the compound, the access roads, the parking lot, the street, the solar lighting system. All those are the works which we have done here.
Okay. Come to the timeline, starting and completion of the project.
Yes.
Yes.
Well, we had the challenges when we started this project in 2022, sometime around Feb. That was the time we were supposed to have started. But there were staff which were in some of these buildings. And they wanted, because some buildings were usable, some were not. So we had wanted staff to evacuate, so that they took some time to evacuate the place. So it delayed our starting time. So basically, major works were done in 23 and 24. And we had hoped that we would do this project in 12 months. But there are so many challenges that, like I've highlighted, that caused our delay up to now. However, the project was ready. And the bureaucracies that we have to go through, we have to write to Ministry of Health for authority. We had thought we would get the president here to commission, but you know the schedules of Mzee is a busy person. However, today we are doing a technical handover. We are handing over structures so that the facility can use them. But when Mzee gets time, or any other high dignitary in government or a minister can come, and we do now the ceremony of commissioning.
Handover today of the 74 housing units. Staff houses means a lot to the hospital. One, it has direct link with the improvement on the quality of service delivery. Because with the new units now, our staff will be sleeping within the hospital. And that will make sure that they come early for work, and also they can be accessed at any time of need when the need arises. So basically we are looking here at improving quality of services that shall be offered to the people of Butaleja and Ugandans at large. Yeah, we shall be able to accommodate 74 staffs, since we have 74 housing units in these houses that have been handed over today. And what I can tell the staff of the Busolwe Hospital who will be occupying this building is, one, we shall follow the right procedure of allocation and handing over these houses to them individually, but also we shall have a tenancy agreement that shall have what to expect from them in terms of managing these houses is concerned. Of course, this tenancy agreement is an extract of the Public Service Standing Order, a provision on maintenance of government houses. We shall expect the staff to adhere to agreement and make sure they take good care of these houses. Challenges the staff faced, one was that where staffs were renting, the quality of houses were not good, the environment around were not good and not safe, and also some of the houses were far from the facilities. So it was actually compromising the quality of life of the staff who were staying there, but also it was affecting service delivery, because sometimes accessing a staff, especially at night, some staff, it wasn't easy. You have to pick them home and bring them back, especially those in theater. To the community of Butaleja and Uganda at large, having received these houses for our staff, as the administration of Busolwe Hospital, we pledge our commitment to offer the best services possible to you people. The hospital is open to you. In case of any concern, any complaint, we are ready to listen to them and respond to them accordingly.
Under the guidance of President Yoweri Kaguta Museveni, the Updf Engineering Brigade worked diligently to ensure that the staff quarters met the required specifications.
My name is Lutamaguzi Betty Kalumba, the Deputy RDC of Butaleja District. Number one, I would love to appreciate the government of Uganda who made it to construct, to renovate the staff houses of Busolwe General Hospital. It has been outcry of the workers and also the community members because they would not receive their services due to the workers explaining there and then that they are coming from afar. So now that the government has managed to put up houses for them, I strongly believe the services will be extended to the worker, to the community smoothly, because this is a beautiful work that has been done. It is very expensive, and I think even the staff members would also appreciate the work that has been done for them. Compared to some other contractor that I see elsewhere, so the worker is good, and I would love to recommend, just in case there is another contract, to be awarded to them because the work is over standard. Yes, our role has been, especially our office, to monitor and supervise the work while it was running. So we would come, advise here and there, supervise, and this is how the work is being done. And we really need to appreciate all the entire district leadership, because they have been in this right from the start up to now. Much as personally I did not start when I was not present when the work started, but at least by the time I came, the district leadership were on ground to see that the work is done and it has to be quality worker, because they also wanted so much the workers to have somewhere to sleep nearby the hospital so that they can offer the services to the people without complaining of the distance. Yeah, thank you very much. I would love, number one, to start with the staff of Busolwe Hospital. These are good houses that are going to be handed over to them. I would love them to maintain them so that we don't lose the image just in a few hours, a few months, and we lose the image. Let them, maintain its standard, and also give services to our people. Also, I would love to call upon the community members to come for the services, because now that our staff, the workers, are given the service, the houses, they are near the hospital, I strongly believe they will always be in the hospital to give services to the community members. So I urge them to continue coming so that they can receive the services.
The completion of Busolwe Hospital staff quarters in Butaleja district marks a significant milestone in the healthcare sector. The new facilities will undoubtedly enhance the working conditions and living standards of healthcare professionals in Butaleja, ultimately contributing to improved patient care.
Now, Updf Engineering Brigade was a contractor. You could say that, but we are partnering with the Ministry of Health to develop Uganda. We are partnering with Ministry of Health to ensure that facilities which are built are long-lasting, they are durable, and they are up to the standard. So UPDF, your Ministry of Health entered into an MOU with the Ministry of Defense to execute these works. And the UPDF Engineers Brigade is a tool. We are the ones who are working for Ministry of Defense. Yes.
Now tell us about the quality assurance involved in this.
We have done quality assurances there. We have done a lot. First of all, I can start with the quality management plan that we had here. The quality plan we had here, one was that the supply of these materials were coming from well-approved sources, factory suppliers. These are notable. Like this was specifically supplied by Uganda, but the iron sheets you're seeing, the painting you see was from Plascon. So there are these approved sources. So the supply is done by our headquarters, the flow of material. So there you are sure that the quality of the industrial material is okay. It's coming from the right sources. They are approved by Uganda Bureau of Standards. And then locally here, we had to mobilize a well-experienced, well-trained staff to do the workmanship. That's why you see workmanship coming out very well. And then there are, of course, a lot of inspections. Like I told you, I think I was interviewed by someone else. I told him that, UPDF works are the ones which are most supervised. Okay. And as you are aware, where you don't inspect, you don't expect. So here we have inspectors or supervisors. First of all, locally here, the local leaders, the LOC1, the area councillors, the LOC5, the other DCs, all these people come and look at the work. Now, the technical person here in the district is the district engineer. But for this project, there was a designated clerk of works from Ministry of Health to support us, to ensure that we don't deviate from the work plan and from the quality which is required.
Any notable technical challenge or innovation related to that?
Now, I wanted to finish on the inspections. So I was saying that there is a clerk of works here from Ministry of Health, and then we have our technical people. We also have a monitoring team from Ministry of Defense, headed by General Masiko. they also come and look at the work. Then the engineers brigade commanders, they come and ensure that we are in line. So coming to your question of the notable technical challenges, of course, you know, when you are doing a rehabilitation, it's not like a new building. Rehabilitation has its own challenges. Like, we didn't expect to remove those walls. But when you are removing the iron sheets, you realize that some walls have weakened, some cracks which are structural, we have to. So in our previous plan, that's been one of the reasons we delayed. We thought we were just going to remove the roof, fix the installations, do the floors, but we found that some walls were weak, you had to reinforce them. When you see, the current electrical systems are not like the old ones. So you realize that the appliances now you need to install there, the wiring which was done earlier, or the embedded conduits cannot handle. So in trying to fit current systems, you find that you create other problems. You find the wall cracks. So we had to do it carefully to ensure that we don't create more problems. So those are the technical issues we had here.
The Uganda People's Defense Forces engineers have installed new plumbing and roofing, giving the hospital a fresh look. Despite initial delays in vacating the old structures, the Updf engineers persevered and delivered an outstanding result, changing the face of the hospital and enhancing staff living conditions of Busolwe.
My name is Richard Dwyer. I am immediate former district chairperson of Butaleja. This project under the stewardship of Minister of Health, Government of Uganda, is a very big benefit to Bukedi district. When the president was coming here some time back for celebrations of UPDF, he asked me when I was a district chairperson, he says, Chairman, and he said it in Uganda, abantu bangabe Butaleja bagamba ki? And I told His Excellency that the people of Butaleja are anxiously waiting for you tomorrow, and kindly as you come, you have answers to the following. One, rehabilitation of Busolwe Hospital. I'm very happy that today, at least I'm witnessing the completion and handover of the staff quarters, which have been beautifully rehabilitated. As people of Butaleja, we are very grateful to the President of the Republic of Uganda, General Yoweri Kaguta Museveni, for being a listening president, being a president whose ear is down to earth and to the community. We want to appreciate Government of Uganda for rehabilitating Busolwe Hospital, one of the old hospitals which had been dilapidated. Government of Uganda has done a wonderful job because people have been complaining of absenteeism of health workers, simply because when the rehabilitation was took over the buildings, the staff were displaced and they had to locate where to stay a bit distance away from hospital. Now the workers are going to be within the hospital premises. Even those who work at night will not find it very difficult. And also to call on a doctor on duty or for emergency when he's a resident of the hospital would be wonderful. These houses are beautiful. They have been remodeled, they have been wonderful, and it is a motivation for staff. The staff are now motivated to work. You know, when you are staying in a very poor accommodation, you can't serve somebody, you can't serve public. But now, I think if when a staff, even a newly recruited staff, when he comes around and is taken around that he's going to take up one of these houses, he's motivated to work. So we are very grateful to Government of Uganda for motivating our workers, and then also the communities have benefited. Our children have been working together with the UPDF. They got jobs here, the technicians, the artisans. We are very, very grateful that communities have benefited, even the food suppliers. This project has been wonderful. It has made the face of Busolwe Town Council change. So we are very, very grateful, and we want to encourage our people, especially the staff, to keep these well-remodeled, rehabilitated houses very well. And we are very grateful, and we want to urge the staff to take care of this. Even inside, when they are using the equipments, they must be careful. And also community, I want to ask community, they should guard the hospital equipment jealously, because these equipments are not for government of Uganda to benefit. They are not for staff to benefit, but they are to benefit we Ugandans here.
Uganda People's Defence Forces Engineering Brigade's expertise and commitment to excellence were instrumental in delivering this project.
This is handover. I talked about it. I said we are meant to, this work got done last year, but we have been trying to get the official processes done. There are some few defects that they identified which were fixed. But for now, today we are doing what we call technical handover. We are handing over the buildings to the district and the hospital for use, and they are in a usable state. And then, like I said, commissioning, where we shall have to mobilize other stakeholders, where the president will come and show his people what he has done for them. That will come later when the president has time. We've learned a lot. We've learned a lot. First of all, the aspect of time. When we entered into an MOU, we thought we would start work immediately. And we've learned that before we start these works, we need to engage the stakeholders to know that the area that you are going to operate in is already evacuated. Because we dragged a lot in trying to start. And then there are other challenges that we have also learned. There were delays in supply. Some of these fittings, our suppliers had to import them. So we need now to know that we must order those items early enough. And then there are, of course, there are aspects of theft that were reported, and we had to swing into action and deployed soldiers here, which was a cost, keeping people around here. So we had to mitigate the theft, and those are the challenges we saw. There's that delay, but by and large, work has been done very well.
Their ability to work efficiently and effectively ensured that the staff quarters were completed to high standards, meeting the expectations of the Minister of Health and the President. This project demonstrates the UPDF Engineering Brigade's capabilities in executing complex construction projects. Their contribution to national development is invaluable, and this achievement is a testament to their hard work and dedication.
Government eshokolire hitutayemwe suubi kwamanya ati ninebira ebahiri uhola ojja kubifuna edwairo bayiguyemu mwaha ogwekinana nengahani esawa ino ebaesa kulungire niwola mutoilet facility nigitahola maji nigali ngasi egirase ezinjigumaho enyumba jose nigitonya nohuwona ngolo wona ati eherese facility eteho ho banyonjo nibone ha ubina basangu befa hola milimo emirangi nibangenyuha mumbera etasi tufu ne ngahani hino government eshekolire shija hongera omutindo mudwaliro lyefwe.
Ndisena Muyanda Rose Nasuga nindi mutuze owe Butaleja era nindi mwihasi owe Busolwe nendo ngino mukisa guno ohweyasa government ya Uganda ehurembran His Excellency the President Yoweri Kaguta Museveni era neyasa naba UPDF abangambya contract yo tuterehesa enyumba jabasangu befe baholira mulimo mweno gwamani enyumba jinekaneka jinyirira niwankubadde mu bahimo toto no butubulimya nenga enyumba ndangi era shimenti jja kutuholera mulimo omweno mulanyi era nendo hubebasa kubanga usawa jino jiri redde era bagitungambisa abasangu befe bajja kutandiha okungenyuhamo niba holo mulimo ogubangewa era husubira nti ebizibu bahini huba nabo abalwaye baja ninga nguma basangu nibakire mingati bangenyuha ibulafu sibishiba yengo era abasangu beffe bose batusuubizise nti bali kujja obuhola emirimu egisapposed uholewa bajja kujjanjaba balwaye mu budde emergencies zijja handlingibwa bulangi era ni bodi yeffe yose yatuwahasa nti bajja kuholera hand in hand okuboneka nti emirimu gigenda bulanyi era basuubisa okukuuma ekizimbe ng'oluba kibangambisye paka nabalijja bose bagane nishishiringo omulembe ni gushiri mungito era hoyongera okubirisa okuholera ngalala kubanga ffe butaleja okuholera ngalala nge district uholera ngalala nabasangu beffe era environment yose ndanyi era husubihise nti ulujjo huyihuma kubanga aba UPDF sinja bali kujja ohozesa wabulefa abangambise abaholeye ndifo huli kujja kuganyulamo nganguma shibishosi eshihusubira nti kijja holango wabula husunga bulala husunga buwagizira husunga nindi government ya Uganda ndituongere kubanga bine byetungaye husimire era hwasima era hwasubisa nti huli kujja hongera huwagira government ehola shina government eriho hulo bulanyi bwa Uganda era no hulo bulanyi bwa bulala.
The completion of Busolwe Hospital staff quarters will have a positive impact on the healthcare system in the eastern region. With improved living conditions for staff, the hospital is better equipped to provide quality medical services to the community, enhancing overall healthcare services and outcomes.
Now I have to pass out to the management of this hospital, the medical superintendent and his team. The facility has been done very well. As you can see, it is neat, it is clean. I urge them to protect this facility and make it, maintain it to the standards. You could do what we call the routine maintenance. You know what we normally challenge, we get people after this, they forget the facilities. Yet there are things that can be fitted, the glass has broken, the wiring system, maybe somewhere there is some small problem. So they need to own this project and have a plan of having routine maintenance and checks where they are where there could be a problem and have it serve the people. And then of course I must pass my gratitude to the Minister of Defense and UPDF, first of all for entrusting me to be in charge of these works in the eastern region. The CDF, Commander-in-Chief, for the trust they have given to UPDF. UPDF has done a lot of works, and we are proud to be part of the development of this country. So our gratitude goes to the President of Uganda and our leaders.
Okay. Then to the community members, because they are the one getting the services.
Of course, the community has been, first of all, they have been supportive in this construction process. There is nowhere you can go into the place and stay for 2 years, and if the people don't like you, you will not manage to stay there. So the community here, the leaders here have embraced us, and we're able to work together. So we really, our gratitude goes to them. Community leaders here, our partners from Ministry of Health, the district leadership, from the chairman, the RDC, the COW, the district engineer, all these people have really played the key roles in achieving the success of this work.
The Uganda People's Defense Forces Engineering Brigade's construction of the staff quarters has transformed Busolwe Hospital significantly, improving the working environment for staff. Once dilapidated structures which hindered service delivery at Busolwe have been replaced with modern facilities.
I must just tell them that this is the time to work for your country, work for your people, because there is no more excuse. If you have a facility like this one, if you are accommodated here, you have a proper accommodation like this one, why not deliver? There should be no reason for a mother to die in the hospital because a midwife is moving from a distance to come and save her, or a doctor is not around. So I want to say that this facility is going to reduce the mortality rate of both the mothers and the children, so that at least we are sure that medical staffs are within. So they shouldn't be roaming around, not being where they're supposed to be. The works our people now expect from them, because the government has done its part to make sure that the medical workers are comfortable.
Maybe your last remarks as we conclude.
My remarks I've already talked. I said our gratitude goes to the community, the leadership of the district, which is from the LOC5, the RDC, the COW, all these big people, the district engineer, our partners from Ministry of Health for the support they surrender to us, both technical and financial. Where this money has come from Ministry of Health. And then the government of Uganda, the president, the CDF, the engineers brigade, and all you, the media, people who have been able to show the public, show the country what government is doing for them. I give thanks to all of you.
Your names once again?
My name's once again, I'm Captain Noah Opio. I am the project manager for works done by Updf in the Eastern region, and I am looking at health projects and some other selected projects within the ministries and other departments.
The UPDF engineers' dedication has paid off, transforming the hospital's appearance and staff living conditions.